I love making the uncomfortable comfortable. I want people to have a healthy sexual lifestyle, and whatever they choose for them, that's okay. And there's no judgment. And I think my job is to make them feel comfortable with that. For women between ages 11 through 20, as they're just starting either their periods or becoming sexually active, we talk to them about safe sex practices, and we also offer them options for contraception, such as long-term acting reversible contraceptives called LARCs. So once a woman enters into the reproductive years and she starts having children, oftentimes the focus goes on the kids instead of we forget about ourselves as moms. When we start family planning and thinking about a pregnancy, the first part of that is mom, making sure that mom's at her healthiest, making sure that she's taking a prenatal, that she's up to date on her vaccinations, that she's exercising, that she has a good nutrition. For some women, maybe they're focused on their career and aren't yet family planning, and just letting them know that that's okay too, and that there are options for them available to talk about what's called egg freezing, and that they don't have to worry about, oh gosh, what happens if I'm 45 and still want to have a baby, but we want to make sure we're having those conversations with them early. So as women start entering 40s, 50s, and 60s, and they enter into menopause, oftentimes the vagina lacks moisture. People often report that sex can sometimes be painful, and there's lots of options to address that too. We get into our 70s or 80s, it doesn't mean that sexual relations have to stop. Sometimes women are starting fresh again and they're nervous or anxious about how sex might be at that point. And I remind them that it's like riding a bicycle, and once they start, they just kind of have to roll with it. It doesn't matter whether you're 24 or 80, sexual health is always something that we can talk about in the office as the issues change according to your age.